And well, it is now just about 24 minutes to 8 o'clock right here on Morning Express, and doing things a little bit different given the situation of where things are. And this is in regards to the COVID-19 coronavirus that has hit the world and of course has changed quite a number of things. We do know that a directive was given by the president yesterday, and that is to close down all schools, day schools, as from today. For boarding schools, it's until Wednesday. And right now, it's just looking at social media, and we have quite a number of schools that, or rather traffic is high in some areas by virtue of the fact that parents have gone to pick their children. One of the questions that we had asked earlier on is whether you feel that these measures taken by government are actually going to contain the virus. And I'll just read some of the comments that have come through. And we have Ken Chirchir who says, "What will I eat if I stay at home, if I do not go to work?" We have Odwere who says, "Case one, when schools are open, students can easily infect or spread the virus to more students. And case two, when schools are closed, infections limited to a few people and controlled." We have Joseph who says, to a larger extent, because of the high school population, congestion in some pupils or students may forfeit or forget what they are supposed to do to prevent the spread. So keep your comments coming. Of course, one of the things that would advise is there need not be panic, there need not to be a frenzy, but we must do within what we have to contain the virus and to ensure that we stay safe as a country. Now, joining me this morning to continue and have this conversation, we are joined by Wilfred Komu Mutunga, who is a public health officer or an epidemiologist, if you like. Thank you for joining us, sir.
Thank you, sir.
We're also joined by Dr. Samrat Shah, who is from the Mediheal Group of Hospitals. Thank you for joining us, gentlemen. And of course, would like to highlight and look at where we are as a country. Let me start with you, Mr. Mutunga. And the measures taken by government, by no means are we downplaying them, but do you feel that there is more that needs to be done?
Thank you very much. First, let me appreciate even your media house. As I was coming, you have put in measures so that the right IPC is being observed. So
Absolutely.
Thank you for that.
And by that you mean you have a sanitizer, your temperature is checked as you're coming in.
Yes.
Those are some of the measures that need to take in place.
Thank you. That's a good work. The government has done what it is necessary in terms of controlling this, prevent and control this. We have seen that schools have been closed. Ideally, if you have been watching the international media, it has been locked down in other countries. Trump had locked all flights from Europe. Yesterday, he did implement now the one for Ireland and the UK. So the government did a very good thing. The president did the best for this country. By locking down all these crowded areas, currently what we should now focus is, when I was here last time, we did not have a case. Today we are talking of having a case.
And I remember when we said, when we were here last, we said it's not a matter of if, it's a matter of when.
Yeah, okay. Now, what we are going to see is now community control, community prevention of this infection so that it doesn't spread. There are some quarters asking whether it was right for the school to be closed. All crowded areas now should be avoided. This is the time to do it because the risk is very, very low. Otherwise, we might find ourselves in the one situation where we have students stuck there, but you cannot bring them because the risk is very high. So this is a time to take these students to their parents. This will reduce the panic we have already. This will also be able now to monitor your children so that if signs come, you can easily take action. It will also be easy now to communicate with your children. But when they are crowded in one place, it is very risky.
It's very risky.
Yeah.
Okay, I'll come back to you, Dr. Samrat. One of the fears that may be there, and one of the things that we probably want to avoid, is mistaking any flu for the COVID-19 strain of flu. How do we ensure that we can differentiate that?
See, there are some typical features for coronavirus. Common flu has running nose, cold, throat irritation, sore throat, myalgia, body ache. These are the common symptoms for common flu. When it comes to coronavirus, Just think that if you have running nose, it may not be corona. If you are having a throat irritation, it may not be corona. For corona, typical features are presence of fever is a must. 90% of cases, they have fever. Apart from fever, the most important symptom is dry cough. If you have a productive cough, it is unlikely to be corona. So they have fever, they have dry cough, and then they have breathing difficulty. These are the three main symptoms for corona. You know, common flu is something which we regularly get because of the weather what we have.
Right.
Very commonly we get common flu. So if you don't have fever, if you don't have dry cough, if you don't have breathing difficulty, do not worry, it is a simple common cold.
It could be a common cold.
Yes.
What are some of the tests that one should expect when you go, when you take yourself in? Because if you have a common flu, we almost as a society self-medicate. You know, you just take dawa or whatever it is that you find. But what are some of the tests that one should expect when you're testing for coronavirus?
See, for coronavirus, there is a particular guidelines which needs to be followed, and then only then we have to test it. Not every person who is having a common cold needs to be tested. As I told, first thing is we need to have these symptoms of fever, cough, dry in nature, and breathing difficulty. Apart from that, we see some X-ray findings which suggest you of bilateral ground glass opacities or bilateral pneumonia features. Apart from that, there should be a history of contact or history of travel. Or now when we have a local transmission, you should have history of contact with those people who have coronavirus. If these criteria are fulfilled, only then we go for testing for corona. There are two types of tests which are done. One is we take an oral swab, one is a nasal swab, and that is to be tested for coronavirus testing. And even one test coming positive cannot be confirmed. We repeat the test again after 24 hours. If it comes positive, then we declare it as corona positive.
All right. Mr. Mutunga, we must admit that Kenyans have really taken this seriously by virtue of the fact we saw churches yesterday had taken quite a number of steps to ensure that they sanitize their hands, and some of the things that we commonly do, hugging, shaking hands, is something that is changing. What more do we need to do to ensure, particularly as individuals, because this is information that we're getting from the Ministry of Health and other health institutions like Medical Group of Hospitals, but what else do we need to do to ensure that we, as individuals, take up our responsibility?
For now, three things are needed. For prevention of this disease, I think we did this in Liberia during the Ebola outbreak. The most important thing, there are only three things you can focus on now. Make sure that you educate the masses, let them have the information, and let them communicate. With that, you'll be able to control this disease very, very fast. They need to know what we call infection prevention and control measures. We need to dispel the misinformation and misconceptions. Because I've been seeing people are still using masks in large numbers, even in churches. So we need to know when should you use a mask. When, like in the local communities, we want to make sure that they understand one of the basic, one basic important thing is hand washing and avoid the contact. So what is needed now is just to give the right information, educate and communicate, both at individual level and even in public. Kenya, we are lucky that the internet penetration is around 70%. Everybody now can get electronic communication. So it is about, even we can now talk with the I've seen the mobile, the Safaricom and
Airtel.
Yeah, they have initiated a method of sending texts. I think with that we'll have bulk messages. The literacy level here is very high, unlike in Liberia where it was very low. People do not have even phones. So now it's about communicating to the people. And there are three areas now we should focus on. Number one is the community level. We want that person at the village to understand what I should do.
What they should do.
We should have now in the village level, we should have community agents. The local administration should be involved now so that any case or any signs and symptoms which might be confused or which is like the way our doctor is saying, you can report it very fast. So report here is very key. So communication is two-way. you communicate to the masses, then can communicate to you. When we went to Liberia for the outbreak, we used to have community contacts, so that we used to be on standby 24/7, so that when there is a case, just a phone call away, we just go to the village, pick that person, we used to have, that time was Ebola treatment unit. So now, even at this level, we need to have a corona treatment unit. If I was to be told, to ask, I would say, let Kenyatta now become a corona treatment unit. Let's have corona comprehensive care centers in the villages. Or if each health center should now have a corona comprehensive care center, a whole area, so that when you have a case, when you have a suspect, that is, you can isolate very fast, because now we are dealing with a case. And the worst part of it should now be the community transmission. Yeah, before we used to talk about points of entry, now we have a case.
We have a case. Okay, I'll come back to you. Dr. Samrat, we've dwelt largely on what one needs to do to prevent.
Yeah.
But we are hardly talking about what do I do if I am infected.
Yeah. So you see, the first thing we need to do is, we should have a thorough information about how the corona spreads to us.
Right.
Once I know that this is the background history, that I have met this person and I have these symptoms, the first thing you need to do is reach the nearest hospital and inform the doctor that I was in contact with someone. The biggest thing that is happening right now is everybody is scared to tell that I was in contact with someone who traveled from outside.
Right.
Yeah. So that information needs to be given to the hospital. Make sure that you are isolated yourself. If you have mild symptoms, corona has mild symptoms and there are some severe symptoms. If you have mild symptoms, you need not worry about it. Do not panic. It's just like a common flu. Just isolate yourself at home. Make sure that you keep yourself warm. Drink warm water. Drink lots of water, at least 3 liters of water. Eat healthy food and fresh fruit. And take paracetamol or some painkillers. That's all is required as of now, if you have mild symptoms of flu. If you are having breathing difficulty, if you are having fever, make sure that you reach the hospital so that you are isolated and treated well. Coronavirus, one thing needs to be understood, that 85% of patients are treated and cured.
Actually, that's one thing that we've not highlighted pretty well in terms of the recovery rate, which is quite high.
Quite high. Most of the people, according to study, 80% of people, they don't even know that they have corona. They just have mild symptoms. Within a matter of 1 or 2 weeks, they recover. They don't even reach the hospitals. It is hardly 10 to 15% of people who develop pneumonia and they reach hospital. Of that, it is only 3% of people who die. You see, the death rate is very low. So we need not panic according to it. I would say the death rate of pneumonia and common cold, what we have in the country, is much higher than what is for corona. So please do not panic about corona. There is nothing serious to worry about it. One thing is to be known, that who should be worried about corona. If you are diabetic, if you are having kidney failures, if you are having HIV, any kind of chronic illness like cancer, if your age is more than 60, then you should be more cautious. You're likely to have severity of the disease. So those are the kind of people who needs to take more precautions.
More precaution. Of course, that doesn't mean that everybody else doesn't take precautions, but we should avoid panicking. And I mean, we've even seen people going as far as panic buying and trying to stock up. Let me come to you, Mr. Mutunga. There's a lot of fake news and panic, of course, that's spreading. What message would you have to Kenyans regarding the fact that there's a lot of, unconfirmed and information that is not necessarily true that's going around?
Just from experience, when we went to Liberia in 2015 to take care of the Ebola, we realized that there were those fake news and the misinformation. Everybody who had fever, people branded that person as Ebola case. When we went there, we started now investigating these people, and we found that only 20% had Ebola. The others had malaria and other causes of fever. So what I'm trying to tell to Kenyans is they should avoid risk communication. They should avoid, we should now be able to, if there is somebody who is a suspect in the village or in the community, let him be brought to the hospital to be processed. Let them not diagnose the patients in the village. It is very risky. Let them follow the current government channels of communication. We have the government spokesman who is confirming this. And also, by an extent, we have WHO, which gives information on its website. Kenyans are literate people, so they should not be misguided people who are in the gutter press. If they want real information, there is a government website, there is a WHO website, and also we have a live tracker for coronavirus. They can even Google it and get it. So to avoid this, people who are in the media should be, and also we need a law. Previously, we need a law on, we need to make sure that Public Health Act Cap 242, it is enhanced so that these people are weeded out, because they can really mess up a country when they just give information from a point of, just from nowhere. They just create the information. We need, so that there is an action if you spread this propaganda. Yeah.
All right, Dr. Samrat, there's also the question of after one has recovered, that the virus can be in you and stay in you for a period of time, and you can become like a carrier. Maybe just advise us more on that so that we are also informed.
Yeah, you see, the study was conducted in China, and it was told that after you recover, for the next 2 weeks' time is the maximum period where you can still infect others. So even if you have recovered from that, make sure that for at least 2 weeks you are at home taking rest for it. That's the maximum period of time that has been found to be infective. That is one study, but we don't have any confirmation about these things. But whatever studies we are getting, they are telling that 2 weeks is the maximum time you need to isolate, even after you are cured from corona.
Okay, and within those 2 weeks, what are some of the things that one should do? Because here you are, you've been cured, but I guess one should still self-isolate, quarantine themselves, and what else can they do?
Isolate yourself, make sure that you are staying in a separate room and not coming in contact with too many people. Even the households, I would say, if you have a separate room, separate washrooms, and whatever materials we are using every day, like phones, laptops, all those things should be isolated. Have as much as telecommunication as much possible rather than coming in contact with people. Make sure that you have your own food material stocked with you. What is maximum to be done is avoid coming in contact with people as much as you can. Each way possible, just make sure that you are not coming in contact with people, or with the instruments are not being carried out to other people. That's the best way to do.
That's the best way to maintain that. All right, and there was also, I mean, there's all sorts of information going around right now. I'd seen an article where they were talking about taking warm and hot, beverages, by virtue of the fact that the virus, initially, before it hits the lungs, stays on your throat. Is that necessarily true?
No, the virus infects your throat first and then goes to the lungs, that's true. But there is no study which has proven that having warm beverages is going to kill the viruses. That's not going to work out. The best thing is try to keep yourself warm, because it's a new virus. We don't have much studies on this.
Right.
So whatever,
we're learning as we go along.
Yeah, we are learning on this. So as much as possible, keep yourself warm, isolate yourself, hand wash yourself. That's the best thing to do.
Okay. Mr. Mutunga, why do you think this has become such a world phenomenon compared to the likes of Ebola, which were much more lethal than what, the coronavirus is?
One, I would say it is the attack rate. The attack rate for corona is very high, but the fatality is very low. Two is about the region. You find that China, and this starts from China, then Europe, then America now. It's coming trickle down to Africa. So there is that the media effect of reporting, because it is affecting a first world country. If Ebola was in China, maybe it could have, or America, it could have in the media, and we could have known it the way now we know corona. I remember we are actively doing surveillance for Ebola in Congo. It is still a public event of international concern. As of now, it has never been declared. The other one is now corona. So there is that aspect of the attack rate. There is the aspect of the region and the people who are being affected. Then now there is a media attention. That's why now we usually say that African media now should be proactive, so that it reports its own issues, so that they have international response. I'm not saying it's not there, but it's not like if it was Ebola was in
the US or somewhere like China.
Yeah.
Okay.
Basically, that is where I'm seeing it is.
That's where it's coming from. All right, Dr. Samrat, how equipped would you say hospitals are, particularly the private sector or even the public sector? How equipped are they to handle this, should it snowball and become bigger than it is now?
I think it should be much bigger than what it is right now, because you see, you will have equipments after you have the testing facility. The first thing you need to have is the testing facility, which I think is lacking to a lot of extent. I think if all the private sectors, all the government hospitals, county areas, they have the testing facility, then is the point where you're going to find out more and more cases of corona. Then is the point when you should start having equipment. When you talk about equipment, it's not just one thing. You need to have a separate emergency area. You need to have a separate area for testing. For even suspected cases, you need to have a separate department of emergency medicine. You need to have a separate ICU. Not just separate ICU, you need to have separate BP apparatus, separate CPAP machines, ventilators, which can be used only for those patients who are infected. You cannot use the common machineries what we use in the hospitals for patients who are having corona. So I think a lot of technology and a lot of machineries needs to be input for that. But the first thing what we need is having a testing facility in the country.
What exactly does one go through when it comes to the testing? You know, if you went for a blood test, you know that blood is drawn, then it goes to a lab. For coronavirus testing, what does one go through?
There is a swab which is being taken. You know, that is also not a common swab what we take. We need a synthetic fiber swab from which we can take a swab from the nasal pharynx or the oropharynx, and that swab is to be put in a culture media, and then it is to be transported to the national laboratory, from where it is being tested in a test called as PCR reaction. It's a polymerase chain reaction, whereas that is being tested from the swabs.
Okay.
That's the first thing to be done if you are having oral pharyngeal or throat infections. There are also bronchoalveolar lavage being taken if you have pneumonias, but that's a very way forward. The first thing you need to have is oropharyngeal swabs and nasal swabs being carried to the laboratories. Even conducting that test, you need a kit, personal protective equipment. The person who is going to take a throat swab, he needs to have a personal protective equipment. We need to have purple nitrile gowns. We need to have long sleeves gowns, complete protection of your face and eyes, and then the person has to take a swab. I think a lot of these things needs to be placed in place.
To be put in place, all right.
Yes.
Dr. Mtunga, you have experience from Liberia, and of course, Ebola, as mentioned, is way more lethal than coronavirus. Would you say that even the medical, practitioners are well equipped so far? I mean, with Ebola, would see them all dressed up with masks and, overalls. But with the coronavirus, I've not seen too much of that. What do you think needs to be put in place, even on the medical, practitioners?
Number one is Ebola affects the cardiovascular system. The bleeding. There's bleeding from all the orifices. We are dealing with a disease now which affects the respiratory system, the lungs. That's why we are talking about pneumonias. We have two types of screening. We have the primary screening and the secondary screening. The primary screening is whereby now you have travelers or people getting to point of entry, or somebody coming to a health facility, or maybe somewhere where people are crowded, like the church. That person you see outside there is a primary screener. If you went to church yesterday, mostly have implemented that. For primary screener, you don't need a lot of personal protective gears, because there's no case per se. You are just looking handy for a case. So for that, you just need a glove, a mask, and a light personal protective equipment. And I've seen you have implemented in your gate. If you get that suspect, the first place I've seen you take is to go to clinic. I heard them talking about temperatures of this. What we recommend is if you have that 7.2, then you are taken to a clinic, where you are done secondary screening. Now, secondary screening, now we need a clinician who should come now wearing those
protective gear
you are expecting now. Because ideally, it's called enhanced personal protective equipment. Because they are so uncomfortable. You cannot put them for like an hour.
Especially given the kind of heat we have in Kenya.
Yeah, so that's also one thing Kenyans are not understanding. When they pass through the points of entry, they expect people to look like they are going to the moon. You wear that when you have identified this is a case, but we also take precaution. The first precautions we are taking is distance. Make sure that there is 1 meter or more from the person you are screening to you. It should not face you, because what we avoid is coughing. Once you cough, you bring what we call a droplet. That is what gets you. That's where the transmission is.
That's where
Yeah. So that cough, when you keep that distance, most likely it will fall on a surface. Now that goes to the second mode of transmission, a fomite. A fomite is that surface now where that droplet has gone. So we have now to wait to prevent this. That's why we are saying you disinfect the area you are working in. And then you use sanitizers, like the way I've seen here. Basically, that's why I'm explaining why you are not see us on those...
with that kind of gear.
Yeah, so Kenyans should understand that there's a primary screening, there's a secondary screening, and now once...
And all those require different kinds of gear and protective
wear.
So, let me come to Dr. Yeah, I'll come back to you. Dr. Samrat, what measures are doctors taking in place? Because another area that could be highly risky is a doctor who handles a case where maybe it's positive and then handles another. So what measures should doctors take in place?
You see, the first thing is, as mentioned, there should be a primary screening area in the hospital also. Every public place for that matter should have that primary screening area. Even we have placed those measures, like the first place is you check your temperature. We have a questionnaire being formed wherein we are asking people whether you have traveled, whether you have anyone in the family who has traveled, you have met anyone who has traveled in the family, and then we are asking if you are having fever, cough, and all those symptoms. The moment we find out those kind of people, we are taking them to the isolation room. Where if the patient has fever, there is history of travel, there is dry cough, there is breathing difficulty, we take them to the isolation room. We are making sure that all the doctors are also having personal protective equipments when they see those patients, especially having mask and gloves. What is more important is having gloves and mask. That's what I feel as a healthcare professional. And we make sure that the patient is given a mask, because he is the one who is coughing or sneezing. We give him a mask and then isolate him, and then we are making sure that we call the concerned departments to come and have a throat swab if there is particular history. And those isolation places, we make sure that there is minimal number of people entering inside. As even yesterday, as His Honorable said, we should avoid entering unnecessary into the hospitals, overcrowding into the hospitals. We are making sure that there are restricted number of people working for specified only for coronaviruses. There is a team which is working only for that place so that they are not exposed to other people. These are the measures, simple measures which we need to take as a hospital also.
All right, we'll soon need to wind up. Mutunga, maybe some of the measures that we may have left out in regards to ensuring that we, as a community and a society, we're having children coming home now. Of course, we'll expect that they're going to be playing, they're going to be interacting, and that can also be a risk area. As much as we've withdrawn them from school, we are also facing another risk area. Your advice?
Currently, I have 3 areas now which we might have these large crowds. Number 1 is a community. Number 2 is a health facility. Number 3 is prisons. For us now, we need to do what we call triage in areas where we can. Triage, like in a hospital, there must be somebody who is, everybody who is coming in must be processed through screening. If it's a suspect, to be taken care of immediately before he goes to the hospital. Prisons, there should be that kind of arrangement. I've seen there has been suspension for 30 days. I think that is okay. Community, now we need to engage community elders, the assistant chiefs, the chiefs, so that where there are large population like gated communities, we have placed areas of hand washing. Let them placed at the gate. Everybody must wash hands before it gets in or out. Areas where now we have minimal numbers, like a nuclear family, let parents educate their children about corona, let them be able to communicate with them and information to come back to through the channel, so that if there is a suspect, what we are fearing now is maybe a suspect, and because this one case had contact, the contacts of the contacts. We don't know the contacts of the contacts where they are. We might have the initial contact.
The person who they interacted with immediately.
Yeah, but now we have contacts of contacts, and that's where this epidemic is a problem. Contact tracing. So the easiest now to identify that contact is to communicate a suspected case, a suspect, so that now we can go there, we pick these people, and we process them.
Okay. Dr. Samrat, your closing remarks, but also as you do that, just to highlight the recovery rate, because I think that's something that we need to keep repeating by virtue of the fact that we may be amplifying the deaths more than they really are.
Exactly. There are two things which I want to highlight. First thing is, we should know that corona pandemics goes in 4 weeks. Yeah, the first week is when we have import of cases, wherein there is only 1 or 3 cases which have been imported to the country. Then the second week is when there is local transmission from the person imported to a local person.
Right.
So now we are in stage 2 where we have imported local transmission. Then the stage 3 and stage 4 are more devastating, because now it starts becoming an epidemic and starts becoming pandemic. You see the way Italy had 1 case before, and then within a matter of 4 weeks, 20,000 cases.
Right.
So we need to be cautious right now. There is no need to panic, but be cautious right now. I think there are right measures being taken right now, because we are in stage 2 right now. So before you land up with stage 3, everyone should understand that take precautions of corona, do not panic. The recovery rate is very high. There is more than 80% recovery rate in coronavirus infections. But that does not mean that you should be careless about it. You should take precautions for corona, make sure that you stay healthy, make yourself follow the self-hygiene measures, and do not panic about corona. I was just trying to separate the word corona. You know, yesterday when His Excellency was telling, I was just trying to understand what we can easily remember it as.
Right.
I would say C stands for what is called as finding out the cases and isolating them. O stands for take an oath that whatever His Excellency has told yesterday, we are going to strictly follow, because it is more of us doing it than the government, because we need to do prevention, what is required.
Right.
That is what O stands for. I would say R stands for regular hand washing techniques to be followed. And then O stands for outing to be avoided. And I would say, as rightly done, Namaste, avoid handshakes, no handshakes. N stands for that, and A stands for avoid outing. That's the best thing to follow.
All right, thank you very much, gentlemen, and I think I'll say namaste on that case. Thank you very much, Dr. Samrat Shah from Medihill Group of Hospitals, and Wilfred Komo Mutunga, who is a public health officer, for joining us this morning. And of course, right here on KTN News, we are committed to ensure that the right information gets to you. But as mentioned by Dr. Samrat, let's not panic, let's not get into a frenzy, but do what we need to do as responsible citizens to ensure that we contain this coronavirus, COVID-19. For now, we're going to take a short break, but do stay with us. We have international news coming up, but also on sports news, the sports sector is not left out in terms of the ripple effect of what has happened. We have even some football stars who've come out and converted or declared that they will have their hotels turned into hospitals if need be. So that's a conversation that we're going to be having right here on Morning Express. So we take a break, but do stay with us.